Hello, everybody. Welcome to today's video lecture, and we continue covering the respiratory system. Please watch my first video to cover the first part. Watch my first video to cover the first part of this PowerPoint. But this is where we stop, and this is where we're going to begin, right? So, blood supply of the lungs. So let me pick up my pen. I don't know if you like this pen or not, but it kind of, I think, makes it purpose or serve it purpose. Okay, now everybody knows that you have pulmonary circulation. So what is pulmonary circulation? When you bring deoxygenated blood from the heart to the lungs, you get rid of carbon dioxide. You pick up oxygen and you bring oxygenated blood back to the heart. So actually this part of the diagram, right, this one, that's our pulmonary circulation. So we have our pulmonary arteries with deoxygenated blood. Here's carbon dioxide. You have pulmonary capillaries. Carbon dioxide goes from your blood to alveoli. From alveoli, you exhale it, right? So it goes to your bronchioles, bronchi, trachea, and you exhale this carbon dioxide. At the same time, inside your alveoli, you have air rich in oxygen. So you pick up this oxygen and you bring this oxygenated blood back to the heart through pulmonary veins. But you also need to deliver oxygen to your respiratory system organs. So you cannot imagine that you have trachea, bronchioles, right? Those are, macroscopic structures. They all made of cells. So it's very difficult to imagine that you're constantly gonna bring only carbon dioxide to your lungs and this tissue somehow supposed to survive. Yeah, that's not going to happen. That's why you have systemic circulation as well. And systemic circulation to your lungs is similar to systemic circulation to your brain. You bring oxygenated blood to your organs and you pick up deoxygenated blood and get rid of it, right? So systemic circulation through the bronchial arteries, and they provide oxygenated blood to lung tissues, supply all lung tissues except of alveoli, and they arise from aorta, right? So it's shown, systemic circulation is shown right here. So you deliver oxygen to all the tissue of your lungs, with the exception of alveoli. So, it's all made of cells. So those cells are going to use oxygen, produce carbon dioxide, and carbon dioxide will move into capillaries and back to the heart, right? The only interesting thing over here that actually this deoxygenated blood over here gonna mix with oxygenated blood coming from pulmonary circulation. So I find it interesting. Now both pulmonary artery and bronchial arteries, they enter lungs through the area called the hilum. So if you forgot what hilum is, need to, I don't know if I cover what hilum is. Let me show you what hilum is. It's not shown here, but now this area of the lungs where you have primary bronchi, enter blood vessels, nerves, this is the hilum. So here and over here, kind of like over here, maybe here will be a hilum. Let's see if I have a better picture of lungs. I'm afraid this is the only picture that I have. That doesn't really, maybe the first one. Let me see the first one. No, this one doesn't show hilum as either. Right, so, well, then you guys need to look inside your textbook. So your textbook definitely has the picture. But yeah, so the hilum is just part of the lung where we have blood vessels and bronchi entering, exiting, blood vessels not only entering, but they also exiting your lungs. Okay, next, we also need nerve supply, right? We talk about blood supply. How about innervation of the lungs? So you have what's shown here in green, it's an innervation of diaphragm and intercostal muscles. Intercostal muscles, diaphragm are skeletal muscles, and this is motor innervation. So this phrenic nerve and intercostal nerve allow you to contract and relax diaphragm and skeletal muscle, and that's how you breathe. But there is also another innervation through parasympathetic and sympathetic division of the autonomic nervous system. So this is somatic nervous system. This one is automatic nervous system, and automatic nervous system controls smooth muscles and glands of the respiratory system. Now, parasympathetic, remember, rest and digest. So when you relaxing, your lungs are controlled by vagus nerve. And when you under stress, sympathetic innervation, then you have your sympathetic nerves. Now, sympathetic nerves and vagus nerve, they form what we call pulmonary plexus. A plexus is network of nerve fibers. And you can see this innervation of your bronchi or of your bronchioles that allow you, when your smooth muscles are innervated, you can contract those muscles or relax. And when your smooth muscles contract and relax, then your bronchioles dilate or constrict. So when you need more air entering your lungs, you're gonna dilate bronchioles. When you need less air, you constrict bronchioles. And the same with secretion, with the mucus secretion, with serous secretion. When you need more secretion, you activate those glands. When you need less secretion, your glands controlled by vagus nerve. I think, I'm sorry, I will take it back. I think glands only control through the sympathetic nervous system. So you just increase or decrease the activation of glands to produce more or less secretion. Okay, now pleura. Now, where your lungs are located? Your lungs are located in the thoracic cavity. It's a ventral body cavity. Remember, thoracic cavity is divided into pericardial cavities, superior mediastinum, and two lateral cavities. We call them pleural cavities. So lungs are inside pleural cavities. They're protected by ribs, by intercostal muscles. Your lungs are covered by membrane. This membrane is called serous membrane. It has two parts: visceral pleura that cover your lung tissue, and then parietal pleura covers the cavity. So if you can see over here, this is our visceral pleura, that's parietal pleura. Between them, we have pleural cavity. Inside this cavity, you have serous fluid or pleural fluid for lubrication. Now, this serous fluid secreted by mesothelial cells, and mesothelial cells cover this membrane, visceral and parietal pleura. So visceral pleura, superficial to lungs, extends into and lines fissures of lungs. Parietal pleura, outer layer, connects to thoracic wall, the mediastinum, diaphragm, pleural cavity space between visceral and parietal pleura, and fluid, pleural or serous fluid secreted by mesothelial cells, and the purpose is lubrication. So when your lungs extend and getting larger, then getting smaller, right? So there is a lot of movement, and we want lubrication when you have a movement of your organ. Now, here's some homeostatic imbalances. First is atelectasis. atelectasis is lung collapse. Now, why your lung will collapse can be because of different reasons. For example, you have your plugged bronchioles, or you have a wound that admits air into pleural cavities. So either you, you plugged your bronchioles that cause collapse of alveoli, or you allow air to move in your pleural cavity. But, this lung over here, it just collapses, getting smaller and cannot function properly, right? So this is a normal left lung. It's a normal lung shown over here, and this is a collapsed lung. Hypoxia means a low oxygen level, so it's inadequate oxygen delivery to tissues. And why would you deliver low amount of oxygen? Again, can be because of different reasons. For example, too few red blood cells, or too little hemoglobin. So that's your anemia. So anemia results in hypoxia, or it can be blocked circulation. So you might deliver enough oxygen to your lungs, but then your cardiovascular system has problem delivering this oxygen to tissue. It can be metabolic poison, pulmonary diseases, carbon monoxide poison. But here you can see your normal cells, normoxia, right? Those are vital cells. They receive adequate amount of oxygen. And here's your hypoxia, and you have decreased oxygen delivery to a tissue. So some cells became hypoxic. So that's low oxygen delivery. And anoxia, when you don't have any oxygen, and when you do not have oxygen delivered to your cells, they start dying. So here you have dead cells. And, if you do not restore this delivery process, the whole organ might die. Right, that's what hypoxia is. Now, chronic obstructive pulmonary diseases. All pulmonary diseases divide, well, I would not say all. Pulmonary diseases, are divided into obstructive and restrictive diseases. Obstructive, when you trap air inside your lungs. So actually you have a hard time to getting air out. This is what obstructive is. I just remember obstructive and word out. So that's a problem of exhaling air. So it's an irreversible disease in the ability to force air out of the lungs. So you can see here two examples, chronic bronchitis and emphysema. Now, emphysema happen when you're losing a protein called elastin in the connective tissue of your lungs. And because of that, if you don't have elastin, your lungs lose elasticity. And, that's why the air cannot be forced out. Now, chronic bronchitis is inflammation of bronchi and bronchioles. Bronchial edema is accumulation of fluid. So if you have bronchitis, if you have inflammation, it will cause edema, cough, bronchospasm, right? So, and as a result, you will have dyspnea, so hard time breathing, frequent infections, again, air trapping that will cause abnormal ventilation perfusion ratio. That means you will not have enough oxygen entering your bloodstream, hypoxemia, low oxygen in your blood, hyperventilation, not enough air actually reaching your alveoli. Right, that's our COPD. Asthma is inflammation of your airways. Now, the exact cause of asthma is not fully understood. There is some genetic factor, but what happens if a patient has asthma, if you look here, you see normal airway, and you have your respiratory epithelium with goblet cells, right? Goblet cells produce mucus, and you do have some white blood cells. Just, normal amount, just in case if you have some pathogens, those cells are gonna take care of it. Now, if a person has asthma, those cells, white blood cells, they start attacking substances that are not supposed to be harmful to you. For example, some dust or pollen in the air. And when your white blood cells, start this reaction, so your immune response, they start proliferating. So you see, you have a lot of white blood cells over here, especially we see increase of special blood cells called eosinophils. So this will cause inflammation. Inflammation will cause the accumulation of fluid, swelling, plus also we see hyperplasia of goblet cells. So goblet cells produce mucus. Now we have increased number of goblet cells, so we have mucus hypersecretion, and it's going to plug, the airways, right? And plus we have a smooth muscle spasm, so that even more decrease the lumen of the opening of the airways. So airways narrows, that means less air can be delivered to the alveoli, plus you have a lots of mucus that also prevent movement of air from your upper respiratory tract to your alveoli, where you have gas exchange. Right, airways thickens with inflammatory exudate, magnifies the effect of bronchospasm. So actually, what begins the episode of asthmatic episode is inflammation. Inflammation as immune response. So you will have immune response to non-harmful substances. This immune response will cause airway inflammation. Now, inflammation cause a bronchospasm, and plus accumulation of mucus in airways, and as a result, we will have hypoxia, right? So here you can see we will have hypoxia, hypoxemia as well, right? So those are the same effect with asthma. So you will have low oxygen level in the blood. As a result, you will have low oxygen in your tissues. Tuberculosis is infectious disease. It's caused by bacterium, Mycobacterium tuberculosis, and symptoms include fever, night sweats, weight loss, racking cough, spitting of blood. And what happens when patient is infected by this bacteria, bacteria enter alveoli, and you remember you have macrophages inside alveoli, and macrophages, trying to do their jobs. They're gonna eat and destroy bacteria. Unfortunately, some bacteria will survive inside those macrophages, and then macrophages will rupture. It shows over here, and bacteria can spread to other part of lungs and other organs. We do have treatment. It's antibiotic treatment that include a long 12 months course of antibiotic treatment. Now, lung cancer. there are many different types of lung cancer. Here we have three most common: squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. So you can see this carcinoma means that lung cancer starts in the epithelial tissue. So squamous cell carcinoma in the bronchial epithelium, adenocarcinoma originate in the peripheral lung area, and small cell carcinoma originate in the primary bronchi and metastasize. About 90% of all cases are a result of smoking of lung cancer. On this diagram, you can see respiratory epithelium, and we don't need to really try to memorize anything. We just, I just want to mention here that you have different cells here, right? You have epithelial cells, you have secretory cells, you have neuroendocrine cells, and depends where this cancer begins, what cells are affected, we have these different types of lung cancer, right? And I think that's it for anatomy part. I will record another video where I will cover physiology of the respiratory system, but that's it for now. Thank you for watching, and I hope it was helpful.